All right. Hi, I'm Tom Maxson. I am a nationally board certified reflexologist with the American Reflexology Certification Board, and I am a licensed massage and bodywork therapist here at Hands On Health in Cary, North Carolina. I'm going to do a quick foot reflexology demo today because it is World Reflexology Week, and hopefully this is going to work. This is the first time I've been teaching through a mask and a filter, so hopefully you can hear me the whole time. I'm going to try to talk and work at the same time. I'm a little bit out of practice with that because I haven't been teaching for several months now. I'm also an instructor here. I teach reflexology at Bodywork Therapy Seminars, which is our in-house education branch. So I'm going to get this set up to get going. My client is on the table. Thank you for watching. I also will not be able to see the screen and notice any comments or questions as we go. So feel free to put those in the comments and I will get back to you and answer the questions a little bit later. Thank you. So you'll notice that with our policy of everyone wearing masks every time, all the time in the building, that reflexology is a great technique for that because you're going to be facing up the whole time, whether we're doing feet or hands. So the client can wear a mask comfortably. It's a lot easier to breathe, from what I hear, than when you're facing down in the face cradle with a mask on. So this is our general setup, how I like to set up the treatment space. This particular client has been working with our team here to get some relief for some low back pain and some hip issues, some back strain in the lats. And I'm going to focus on some of those areas on the feet. But reflexology is also for general relaxation, trying to manage stress throughout the whole body. So just like with massage therapy, I'm not going to focus only on the problem areas. There's a lot of things that are going to affect the body holistically. This is a holistic modality. As soon as we start talking about the foot reflexology chart and the map, it's going to be easy to get into a diagnostic mode, and a lot of people will feel a tender spot on their foot while they're receiving reflexology, and they'll say, "Oh, what's that?" And I'll say, according to the reflexology chart, it's your gallbladder point or your gallbladder zone or upper digestion. And they'll say, "Oh, what's wrong with that? Is something wrong?" And it's not a matter of diagnosing a condition like a medical doctor would. I'm still looking at stress, levels of stress in the body. Where are there weak points in the body or overworked areas of the body versus healthy tissue? And I can see those kind of details about the whole body by markers in the feet. We call them markers. Any kind of bump, any kind of red spot, dry spot, cold spot, hot spot. Every kind of marker means something. I also get a lot of clients who want to scrub down their feet and trim their nails and get a pedicure before they come in. And all those kind of things are great, but that kind of hides what the body is telling me through the feet. Best case scenario is I can see every bump, everything, every callus, everything that's there, because everything means something. The body is showing neurologically where there are stress points. The technique that I'm demonstrating today and that I talk about and that I teach and that I practice here at Hands On Health in Cary is Western reflexology primarily. I have some training in traditional Chinese medicine, integrative reflexology, some Ayurvedic points. There's perspectives about footwork from all over the world. Traditional Thai massage has some excellent foot techniques. But what I primarily focus on, and the great bulk of my training, is Western reflexology, which is based more on the nervous system. Not that there's anything wrong with all those other techniques, they're amazing. Just my specialty is the neurologic-based Western reflexology. So what is reflexology? Obviously, I'm talking about the feet and demonstrating on the feet, but any extremity of the body, the hands, the feet, the face, or the ears. There's even techniques for the tongue for reflexology points. The basic core understanding is that there is a mappable, organized way to see the entire body, every system of the body, every joint, every muscle, every tissue, every organ is indicated in some arrangement on the foot or the hands or the face or the ears. And by doing a specific technique, which you'll see is kind of an inchworm technique, we call it, where we're going down, press and release, press and release. The basic technique, which sets reflexology apart from massage therapy. There's not much sliding or gliding. There's not much oil or cream, if any. According to the American Certification Board for Reflexology, they don't use any kind of cream. For our practical examination to get nationally board certified, we're not even allowed to use cream. So that sets it apart from massage therapy. And it's kind of interesting right now in the reflexology world, there's a big debate, and it depends completely on where you are in the world. Where does reflexology fit in medical modalities or spa modalities, distinctive training, different testing, examinations? There's a national body that regulates and sets the standards for practice in this country. And in the States, generally speaking, foot reflexology is seen as kind of just a relaxing spa treatment. And in other countries, a lot of other countries, it is seen much more as a medical technique or a nursing technique. Nurses do foot reflexology on patients who are undergoing chemotherapy or while they're receiving kidney dialysis. And all of the work that I do in any kind of body work should not be painful. I say to almost every client who gets on my table, this should not hurt. Let me know if it does hurt. One of the primary differences also between what and other modalities of footwork is that it's always within the client's comfort level. More is not better. There are definitely techniques that are taught to grind into the tissues with a knuckle and brusquely, aggressively grind through areas of the feet, and that is counterintuitive to me. If the brain feels like your body is being attacked, it's going to start putting up about a holistic, relaxing, therapeutic kind of body work. I always want to encourage the body to move over to a rest and digest state of mind. The parasympathetic nervous system, quiet, calm, rebuilding mode of the body, not stressed out, not fight or flight. And Foot reflexology is very good at that. I have countless people who have gotten up from a foot reflexology session, woken up from a foot reflexology session, and then they feel refreshed and renewed, like they've had a long nap, and it's been 45 minutes. Some of the other notable benefits of foot reflexology that have been studied. I bring these up because as a very clinical medical massage therapist, which I was for 12 years before I even took a reflexology class, I look at the world through a very skeptical, science-based, evidence-based lens. I want to see everything that I do have some kind of basis for factual evidence that it's going to work, that I can expect some reliable results. And some of the good science that's been happening in the last several years is that foot reflexology is excellent for anxiety, excellent for depression, excellent for sleep quality. Anxiety, for example, is the most commonly diagnosed psychiatric condition in the country, in the United States today. And there's a lot of money being poured into treatment for anxiety, and pharmacological solutions have not done a really great job. They are not reliable in terms of knowing how it's going to affect your physiology versus the next person's physiology. There's a lot of trial and error, even under a medical doctor's care, a psychiatrist's care, getting the dosage right and the time of day right to take a lot of anxiety medication. There's still a lot of things that we don't know about how they work. And there's side effects sometimes, and it's a very there's just a lot of unknowns and gray areas still as we study more and more about anxiety. So foot reflexology, I really love that it can have a positive beneficial effect, and there's virtually no side effects that have been found with foot reflexology. So as we study more and more from the medical field and get more and more accuracy with dosage and specific chemistry of the brain, because the brain is the most complex organ that we know exists on the earth. So of course we're not going to know exactly how everything works yet. But if we can focus on bringing general relaxation and setting the stage in the entire body for neurological balance from the foot, that can only help what's going on in the psychology. So as I was saying, in a lot of parts of the world, there are nurses who do reflexology. There's a lot of good palliative care, end-of-life care, just a lot of compassionate care that's going on in different places in the world. And I'm really excited about World Reflexology Week because we get to talk about how we can use reflexology in a more diverse way in this country. I feel in the United States, it's still kind of either unknown or ignored as a useful technique. It's just a nice thing that makes the feet feel good, which it is, but I think there's a lot more depth and profound effect that's going to come from foot reflexology that we're going to find out more and more as we understand more about how it works in the body. So again, if anyone has any questions, I am always happy to talk about this topic. It's one of my favorite things to learn about, and if I don't know an answer to something, I love to do the research to figure it out. So please leave a comment or send us a message or come in and see me. Here in Cary, we have clients from Raleigh, from Durham, from all over the Triangle, and we have a team of amazing therapists here who have extensive expertise in all kinds of modalities, namely deep tissue massage, meaning neuromuscular therapy, meaning myofascial release, which is where I have my background as basically a myofascial therapist, is where I started, and I still practice that every day here too. We work with a lot of athletes here at Hands On Health. We do medical massage, meaning we coordinate well with doctors, with physical therapists, with chiropractors, all kinds of other practitioners. We are happy to work with them and take guidance from them in however we can as a team help you get pain relief or stress relief or improved performance doing whatever kind of athletics you're working on. So thank you so much for watching. Again, I'm Tom Maxson, LMBT, Nationally Board Certified Reflexologist, speaking to you from Hands On Health, Massage Therapy and Wellness here in Cary, North Carolina.